Welcome, Gyno-Curious listeners. I am Dr. Amy Novat. We are here to investigate what it means to be a healer and to be healed. Menopausal women are all around us. As the baby boomers live up to 40 to 50 years in the postmenopause, this time in the lives of vulva havers has to be explored and discussed. As I move through this time in my own personal life, I felt compelled to discuss the many changes that can go on during this phase. I have asked a woman who is newly exploring the physical and emotional shifts that occur with the loss of the childbearing and the child-rearing years to discuss with us how it has been to be in the postmenopause and how this has impacted her. I am sure this is just the beginning of a conversation about this topic, but I want to welcome Laura into the studio today to start our exploration into this area of how we live and be well during the crone years. Welcome, Laura Schulkind, a busy mom, worker, spouse, and community member.
Thank you.
So just a bit of history and definitions before we start for our listeners. The menopause is the last menstrual period in a woman's life, and anything beyond that is the postmenopause. A French physician first coined the term menopause in 1821. Medical interest in menopause increased considerably in the mid-19th century, interpreting it as a deficiency disease. Replenishments included testicular juice and crushed ovaries of animals. These were just some of the remedies they recommended. And then in the 1940s, Premarin, an estrogen from a pregnant mare's urine, was marketed as an estrogen replacement therapy for postmenopausal women. And from that point on, the medicalization of the menopause picked up immediate and rapid pace. In the U.S., the mean age of the menopause is 50 to 51, where in developing nations it tends to be lower. Since life expectancy for women is so much higher than in early 20th century, we have so many more women experiencing the postmenopause than ever before. So, Laura, when was your last menstrual period?
Let's see, 3 years ago. So I was 54.
So again, you were on the higher area of that range. So I remember my mother, when I was a teenager, walking around her house, kind of stripping off clothing because she was sweating so much, perspiring from the hot flushes, just not being always so nice to us. And I had absolutely no idea that this was what she was going through. Would you say that there was any family folklore about menopause or postmenopause in your life?
Actually, in my experience, my mom had a full hysterectomy when she was in her mid-40s. So she actually never went through menopause. She definitely did some hormone replacement, but, you didn't talk about those things in my family. So she always asked my sister and I, what's it like? What are you doing? How does it feel? What are the hot flashes all about? So it's a funny thing. We're teaching her.
It is funny, and it's she's a lucky woman. Many of us would say she was lucky in many respects, right?
I frequently told my doctors, take it all, I'm done. They don't seem to want to do that.
Yeah. Between hot flushes, night sweats, memory changes, vaginal changes, sexual changes, these are all pretty universal signs. Almost every woman has at least one of these symptoms once at least during the perimenopause, postmenopausal time. But they're variable for each woman in terms of timing, duration, impact. What would you say were the events that happened to you and were most impactful?
Well, I remember my first hot flash. I was in Winter Sun, Summer Moon with my daughter, who looked at me and said, Mommy, are you okay? We had to run out and get a brownie across the street. But from there, I realized that I was now fully in perimenopause, and it dragged on for a long time. I didn't realize that period was quite as long as it is. And I said to my sister, who's 8 years older than me, how long does this take? She said, let's see, I've been doing it for 15 years. So good luck to you. I think definitely there were lots of changes. I went through a period of really foggy brain and found that I was deficient in D pretty significantly. So we took care of that. And I started listening to what my body was telling me. And if it wasn't normal, I sought the advice of professionals. So it was relatively painless, the perimenopause thing. I had some really unpleasant bleeding experiences and that kind of thing. But, my body started doing strange things. I grew fibroids. I took care of those. It was just all sorts of wonky things that you don't necessarily expect. And I think a lot of women get to this moment and they've heard about the hot flashes, they've heard about all that kind of stuff, but they don't really have an expectation for new growths in your body or anything like that. And I think it's important for women to know that these are possibilities and they can happen to you. And just you got to stay in touch with your doctor and you got to listen to your own sense of self and what's going on and do the research, figure out what's going on so that you can get through it more easily.
It's true. It's such a potential time of tumult. And us women have these rhythms in our lives called the menstrual cycle. And for so many years, we have an understanding of our body and what might be going on vis-a-vis the relationship to the first day of our menstrual cycle, right? Oh, I might get a headache the day before. Oh, I might feel bloated. Oh, you better not talk to me because I'm in a rage because I'm 3 days before. And that kind of rhythm helped us understand what was going on in our body. And then there's this experience called the postmenopause where we don't have that hormonal tempo, if you will. And so these changes can be just rather shocking and challenging and new. So I'm sure every one of our listeners has read the recent New York Times articles, and a quote that I just had to bring up was, quote, "We have a high cultural tolerance for women's suffering. It's not regarded as important." And I thought that set the tone for centuries of women who suffered in silence, shame, who aging was just not valued and respected and certainly not revered. And so I'd like to hear from you how the menopause, which is certainly a manifestation of the aging process, has impacted you kind of emotionally and even intellectually.
I would say that I was emotionally ready to be done with my childbearing years. There is a little bit of freedom now. My kids are grown and are off doing their thing now. And so my husband and I are actually having a life again. We're doing our own thing again. So in some ways, it's been remarkably freeing, and I've gone back to work after being a mom for 20 years, and I will always be a mom, but so it's been okay for me. I don't feel loss and sadness and all of that. It's really sort of a renewal for me. And I hope there are lots of women that feel that way because it is just another next phase in your life. And I'm doing a lot now and I'm busy and it's really gratifying. I'm incredibly grateful to be able to do all of these wonderful things and learn new things and experience new things. So it's been good for me.
Yeah, it's interesting. In my office, there's not infrequently a woman who comes in who feels a great deal of grief and loss over her reproductive capacity. And like you, I like to say I'm unclear about a lot of things in my life, but the one thing I'm really clear about is I am done having babies.
Kitchen's closed.
Exactly. And there is a divide. There are women who are terribly saddened by the loss of their reproductive capacity, which of course is what the menopause signifies. And then there are those of us who relish the movement beyond that. Yeah. I want to come back to something that you brought up earlier about this phenomenon of growth. And what you're speaking about are fibroids and endometrial polyps and breast disease, for example. So, Laura, you've mentioned endometrial polyps. And can you tell us a little bit about that experience? Because I'd like to share with our listeners what kind of symptoms or signs they might look for during this menopausal transition that may indicate that something is going on, something is growing.
Sure. 2 years after my last period, I had some strange spotting. And when I saw that, it was concerning. And I guess about a day or two before that, I had some cramping, which was weird because I haven't experienced that happily for 2 years. So the bleeding really is what set me going. And I happened to have a regular GP doctor's appointment coming up. So mentioned it, and I have to say they were wonderful, and they got me in to see my favorite gynecologist almost immediately. And we ran through the tests, I had to do a vaginal ultrasound, and we did lots of blood work and discovered that my uterine lining was now home to many little polyps. So the course of treatment was take it all out or get a DNC. And so we opted for my doctor's recommendation of a full DNC, which I was perfectly happy to agree to. And really, the recovery from that was incredibly easy, which my doctor had said was the case, probably would be for me. I felt great after the surgery, though a little loopy, I have to say. The anesthesia is a little crazy. But I let my body rest as recommended, and I was back at it 2 days later, so it was all good.
Great. Thank you. Thank you. So I want to highlight that the most important sign and / symptom that a woman in the postmenopause. So again, if a woman has gone a year without bleeding, even a day beyond that, so to speak, if you have some spotting or bleeding, you really should let your gynecologist know, because that is often the earliest sign and symptom to indicate something's going on. The majority of women who bleed in the postmenopause have nothing dangerous going on, meaning not a cancer. But a smaller group of women will have endometrial polyps and cancers. And endometrial polyps in the postmenopause are believed to be, based on really good science, pre-malignant phenomenon. So you want to remove them. And this is in contrast to someone who is perimenopausal or reproductive age. If they have a polyp, we often will use medications, or we won't ignore them, but we'll follow somebody's menstrual cycle to see what's going on. But in the postmenopause, the standard of care is to remove those polyps. And certainly the least that you do is to do an endometrial biopsy. And that is a sampling of the lining of the uterus that can be done in the office setting or in the hospital. So the DNC is in lieu of the endometrial biopsy. If an ultrasound indicates there's polyps, we will often just say, let's go for a DNC, whereby we'll remove those polyps, we'll remove the lining that might be thickened, and that's the biopsy. That's sent to pathology and evaluated by a pathologist who can tell us everything's benign or there's precancer or cancer. So a DNC is a procedure that we do a lot of in this time frame in the postmenopause. And other symptoms that women might describe is certainly a change in bowel or bladder, changes in the way their pelvis feels, pressure, pain. And I always say to my patients who are worried about, quote unquote, bothering me, and I always say to them, first of all, that's my job is to be here for you. The second is that, won't it be wonderful if we celebrate that there's nothing wrong, as opposed to you coming in months later and we are having to take care of a problem that's really well advanced. So I would say to you, as difficult as the medical environs are today, in terms of getting an appointment, getting through in a phone call, if you can walk up to the desk in your local gynecologist's office, do it. Do not hesitate. Do not assume that spot of blood, which I have diagnosed cancer from, one spot of blood in the postmenopause, is nothing, because hopefully it is nothing. It's a result of what we call atrophic bleeding, which is just the kind of paradoxical drying and thinning of the lining of the uterus that then sheds, and blood vessels are rubbing up against each other in the uterine cavity, and you get some bleeding from that. Or it may even be from the vagina or the cervix after a sexual experience. Whatever it is, it's time to come in if you have any of those symptoms. So never be reluctant. Try to march your way right into the front desk, because in all of these large organizations, it's become quite cumbersome to get through to your doctor. I'm fully aware of it.
Yeah.
Yeah, thank you. Appreciate your sharing this story with you.
Sure.
With us.
The flip side of that is how amazing that your body is geared to tell you that there is something not quite right. And that's pretty cool.
Absolutely. I think that's a wonderful thing to add, is often women are not listening to their bodies, and mostly because they're listening to everybody else. They are taking care of family members. They are taking care of jobs. They're taking care of communities. They're taking care of everyone around them, but they're not taking care of themselves. So I think one of the more important messages of today's conversation is please take time, take a breath, spend time reading so that you know your body. And if you don't understand what's going on, ask your friends, ask your doctors. Don't ignore it, and don't spend months assuming it's the bad hot dog you ate 3 months ago that's giving you indigestion. It's probably something else. And I just want to explain to the listeners what causes those changes. Specifically, there are hormonal changes that define the perimenopause and the postmenopause, and specifically the ovarian function changes as you move into the postmenopause. And specifically what's happening is your estrogen levels are dropped, your progesterone levels are dropped, and even your testosterone's dropped, but just not at the same degree. And as a result, the menstrual cycle no longer happens, and there are body changes that occur. So as we move through this perimenopause into the postmenopause, there's more estrogen initially than there is progesterone, and that change in the ratio of estrogen to progesterone early on and the absolute amount of progesterone, making us estrogen dominant is the descriptive term that we use, does set us up for the growth of fibroids, which are benign smooth muscle tumors in the uterus, or endometrial polyps, which are glandular growths on the lining of the uterus, or breast disease, breast cancers that are estrogen related or estrogen receptor positive. And so this is also a shift for so many women who have enjoyed really relatively great health. Thankfully, the majority of these growths are benign, but they do require sometimes intervention, sometimes medicinal, sometimes hormonal, sometimes surgical. And this is challenging for women who have certainly experienced real good health. And then, of course, in the postmenopause, there's this deficiency of estrogen and progesterone, which increases our risk of osteoporosis, heart disease, dementia, etc. And so that's also a shift for us. For so long, we are told, in comparison to men in particular, that our heart is strong and that heart disease is not a common phenomenon. And then we go through this menopause, and all of a sudden, heart disease becomes a real risk for us. So again, this kind of shifting, I think what you're pointing out is there are light and shadow to this change, and that there's positive aspects, this kind of liberation, this movement beyond parenting, if you've been a parent, opportunity to change one's lifestyle. And then there's challenges, physical challenges that are real and become a part of our day-to-day life. So how do you maintain your well-being in your day-to-day life?
Well, let's see. I'm exercising for the first time in a long time.
Excellent.
So that's really good. And working and just moving through my day. But I think I mentioned it earlier, listening to the new rhythm of my body and discovering things like, oh, yeah, now I've got some polyps, so let's take care of that. And I think it's really important to pay attention to your own body and what's happening with it. And I think women in general, the centuries of our suffering not being important, tend not to want to bring it up. It's something weird, so I'm not going to ask, and it's so embarrassing, but it's not embarrassing. It's your body going through this next phase. You want to maintain optimal health, obviously, and if you don't listen and consult the experts, it could potentially not go so well for you. I think that just knowing that your body is changing, and that's okay because that's what it's meant to do. But sometimes there are people like me who have the polyp that needs to get taken care of. And it's okay because we have professionals and we can take care of these things. And it's not a bad thing. It's actually really a remarkable thing that the body can then heal again and move on.
Great. I think you've addressed my last question for you, which was, what would you say to your younger self or to others in preparation for the menopause and beyond? And if I might highlight, it's seeking professional help. It's being aware and accepting of body changes and aging and talking to other women and getting rid of the shame and embarrassment about the changes in our body and instead glorify our relative health the fact that we are alive and moving through time, and that we are continuing to teach other women all that we are learning.
Yeah.
Yeah.
It's important.
Great. Laura, I can't thank you enough for sharing your intimate story with us. And thank you to my listeners for joining me as we venture into the limitless conversations about our bodies and the world of OBGYN. I would love to hear from you. Please email your questions and comments to comments@radiofreerhinecliff.org or call us at 845-307-7446. Also, thank you to my producers, Jen Hammoud and Matty Rosenberg. Until our next conversation, stay healthy and stand strong in your knowledge and your insights.